1 million people live in Tegucigalpa. Violence, for the most part related to drug trafficking, is endemic. The situation is particularly tough for people living or eking out an existence on the streets, as they are often victims of violent crime and have no access to health care. Ambulances no longer venture into dangerous areas, and the capital's only emergency room is stretched to the limit. In 2011, MSF started to go into the most deprived areas of the city to provide health care to people who would otherwise have no access.
The first challenge is to ensure the safety of the teams. The second is to provide a medical response. This is complex because the violence can be physical, sexual and psychological, and the healthcare system is sorely lacking. There are major issues with human resources and medical drug supplies.
Diagnosis, rapid provision of primary care and psychological support are all dispensed out on the streets. Patients requiring more advanced treatment are referred to one of the facilities where MSF is based. The mobile team is gradually gaining the trust of patients and manages to persuade them to get medical help. The team has carried out 4,500 consultations on the streets over the past 9 months. For the third time in 3 months, Ami Diabate has brought her children to the health centre in Mali's Kutiala district. Each of them is given 2 tablets and then sent home with 2 more to take over the next 2 days. 4 tablets to be taken every month between July and October. A simple gesture, but with an immediate impact.
My children used to have temperatures really often. They hardly ever do now that they've started taking the medication.
Administering SMC to children in Chad and Mali has reduced the number of simple malaria cases by 60 to 80%.
In the hospital in Kutiala, we saw the results almost immediately, a few days after the distribution. Before administering the treatment, we had 300 hospitalized children, and within a few days, we were down to 150. There were loads of empty beds. It was simply unbelievable. Especially as during the same period in previous years, we had always been at full capacity.
The treatment recommended by the World Health Organization will not eradicate malaria definitively. But in countries like Chad and Mali, where malaria is the first cause of infant and child mortality, it does have its role to play in emergency situations. Dieme tells us his story. 2 months ago, he'd gone to get water when an armed man attacked him, leaving him with a severe leg wound. The MSF surgeon treating him at Rutshuru Hospital had no choice but to amputate. The physiotherapist is now working with Dieme on gaining muscle strength in order for him to be able to walk again with the aid of an artificial limb. MSF has been working at the General Hospital in Rutshuru since 2005. The organisation has not observed any increase in the number of wounded, but cannot be sure if the fighting has really lessened in the region. It is quite possible that there are simply more dead than wounded. In the hospital corridors, Dieme is gradually recovering and adjusting to his new life.
We need to ensure the child's full integration back into society, which means he must return to school. So MSF has contacted the ICRC, which provides support with this kind of issue. Dieme is now signed up with a program which will provide him with a prosthesis, so he will be able to walk like the other kids without feeling self-conscious.
Dieme will be able to leave the hospital as soon as his wound heals. In the meantime, all he dreams about is going back to school.